If you're dealing with back pain right now, whether it's been there for 3 days or 3 years, I want you to watch this entire video because by the end of it, you're going to understand more about what's actually happening in your spine than most people learn from 3 trips to the doctor. Look, my name's Dr. Dustin Scott. I'm a chiropractor in Ames, Iowa at the Connect Chiropractic. We specialize in finding the actual source and the cause of back pain, and we're able to fix it without surgery, without long-term medication, and without giving you vague, generic answers. Here's the uncomfortable truth. Most conventional pain pills, steroid shots, conventional back pain treatment, it's designed to manage your pain. Manage, right? Not treat it, not fix it. It doesn't resolve it. You go in, you get an x-ray. You might get an MRI. What do you leave with? Typically muscle relaxers, pain pills, right? You're told to rest, right? Take a load off. Take it easy. A few weeks later, gets a little better. 6 months later, it's raging back. Worse than before. Does that sound familiar? The reason it keeps happening is symptom management, right? The root cause, the correction are completely different things. Anti-inflammatories will reduce swelling, right? They don't fix why your disc is pressing on the nerve. Muscle relaxers will relax the muscles. It doesn't correct why the muscle is actually protectively spasming in the first place. Without addressing the underlying structural and neurological cause, the pain relief will always be temporary. That's the first thing I want you to understand. And everything else I'm going to tell you today is going to build right there on that foundation. Low back pain is not a diagnosis. It's a symptom. And it can come from several different sources. Let me walk you through the 4 I most commonly see in practice. So number 1, we'll see someone come in with a muscle or a ligament strain. These are typically athletes, maybe even younger individuals. We take care of a lot of track athletes, a lot of volleyball players, softball players, rotator cuffs, right? This is a classic pulled muscle, right? Maybe you pulled your back. Usually maybe it's from lifting or overuse, maybe a wrong movement. Okay, this is accumulated tension from potentially sitting too long. The pain is local. It doesn't radiate, doesn't go down the leg, gets better with movement. This is the most common and usually the easiest to treat. Okay, now number 2, these are disc problems. Okay, your lumbar discs, the shock absorbers that lie in between each of the joints. This can bulge or herniate. Everyone's heard of a herniated disc, a slip disc. When that happens, the disc material is literally pressing outward, okay? Often towards a nearby nerve, right? The nerve root itself. So this is going to cause local back pain, but it's also going to travel, okay? It's going to travel down the leg. It's going to radiate. Symptoms will typically cause sciatica, okay? That's L4, L5. It's going to be L5, S1, okay? Those discs are by far the most common things that we see. Honestly, I mean, that's our bread and butter, right? It's the most commonly affected. Number 3, okay, we got the facet joints. Each vertebra, each joint at the back, it's called facets, okay? They slide and glide. They can get restricted with motion after being under pressure for too long. Okay, this worsens with extension. Can't sit up straight. Maybe bending backwards or just standing for long periods of time. Number 4, last but not least, the SI joint dysfunction. The SI joint, this is where the sacrum, the tailbone kind of meets the pelvis. It's one of the most commonly misdiagnosed pain sources that I see. Pain that's deep into one glute, into one buttock, sometimes radiating into the outer hip, maybe the upper thigh. It feels like hip pain, but it isn't. We see this most commonly in women. Pregnant women, particularly, are most prone to this. And there's a reason why. There's a lot of stress happening, and those ligaments start to be put under a lot of tension. The ligaments will start to become a little bit more relaxed because of the hormone production. I'll tell you what, specific chiropractic adjustments are the #1 effective treatment available for this pattern. We love our pregnant moms. We see a ton of them. We love them. They get better. Every pregnant mom should get chiropractic care. Now, I want to spend time more on the disc injuries. These are the most severe, typically the most involved, typically they've been there the longest. First, a disc herniation does not automatically mean it needs surgery. Studies will consistently show that the majority of the disc herniations, they reabsorb. Okay, so meaning the body actually absorbs and removes the herniated material over a period of 6 to 12 months, as long as you're getting the appropriate conservative care. This is not an opinion. It's so well documented, and this is why our clinic decided to be the top decompression clinic in mid-states, in Iowa. There's nobody running as much decompression as we are. There's nobody healing as many discs as we are. This is well documented. Reach out. I might even post a link so that you can see those studies for yourself. Second, the size of the herniation on an MRI does not always correlate with the severity of your symptoms. So I've had patients come in, massive herniations, 10, 12 millimeters. On imaging, minimal pain, right? The patients with small bulges, hitting that nerve just right, debilitated. What matters is how the disc is interacting with the nerve tissue, okay? And that's all clinical, right? It's not imaging. So we get into that, and we make sure that obviously the right intensity and the right severity and the right protocol at the right pull is set up for you. We do it gradual over time. Third, the most effective non-surgical treatment for disc herniations, spinal decompression, right? This is misunderstood across the board. People don't know what to do about these. Easily spinal decompression therapy. I'll explain how this works in a moment, but the mechanism is kind of what matters, right? By creating precise negative pressure in the disc, pulling it open, we can draw in like a tube of toothpaste. We can draw that herniation material back towards center, back into the canal, right where it belongs. Many of our patients with significant disc injuries, they avoid surgery entirely with this protocol. Now, sciatica, right? What's actually happening? What's actually causing the leg pain? Everybody's asking, and of course you want to know. Sciatica is not a disease. It's a symptom, right? The body's sending off an alarm. It's a symptom. Your body's telling you something. My job is to find what that something is, right? So sciatica specifically, it's going to refer to pain, numbness, tingling, weakness, depending on your condition. It's going to travel down the sciatic nerve, down the leg. It can come from at least 3 different sources. Okay, the most common we see, lumbar disc herniations, L4, L5, L5S1, right there at the tailbone, pressing directly on the nerve roots and the sciatic nerve. This is the same seat that we're sitting on all day long if we have office work. Same seat if we're driving for long distances. There's pressure sitting on that shock absorber all day. So this produces a specific dermatomal pattern. It means it's either numbness in a predictable pattern, going down the back, going down the side, going down the front. That's all going to be indicative of different disc herniation at different levels. Now next, definitely underrated, piriformis syndrome, right? Where the piriformis muscle deep inside that glute compresses down on the sciatic nerve. As it passes underneath, sometimes it's through the muscle. 60% of people, genetically, their sciatic nerve runs through the piriformis. Whether you know it's you can't tell. Nonetheless, you need to make sure that obviously you're taking care of the piriformis, taking care of the discs, and we'll make sure to do the proper evaluation to figure out exactly which one it is for you. It's honestly probably one of the most frequently missed, and it improves fastest with our soft wave therapy. So the third, spinal stenosis. Nobody typically knows how this looks, how it comes, anything about it. That ends today. You learn now. This is most commonly here in older patients, right? Produces symptoms that's typically worse with walking, improves with sitting and bending forward because it's taking pressure off the spinal cord. But why does this matter? Because the treatment's different, right? Different expectations. Disc-based sciatica responds best to decompression all day. Piriformis, you're using soft wave. You're doing specific adjustments, a little bit more soft tissue work. Stenosis, going to be the worst, right? Requires a combination, decompression, specific exercise to stabilize the spine, and of course some lifestyle modification. So we need to evaluate. We need to figure out exactly what level you're at and treat it properly. How we evaluate back pain at the Connect Chiropractic, right? When you come in and see us, that's what everyone wants to know before they show up. The first thing I want to do is you just understand the story, right? Not just where it hurts, but how long has it been there, right? I need to get to know this pattern. What makes it better? What makes it worse? Okay, what have you tried? What your life looks like before the pain started. That's a big part of your pattern. We can tell a lot, and we can start to shift and change what that pattern looks like moving forward. Then, we got to do a comprehensive physical examination. Check the posture, range of motion, orthopedics when necessary, and maybe even some neurological testing. I want to know which structures are involved and what the nerve supply to those structures looks like. So, many cases, we'll take an x-ray. Position and condition matters. We can tell joint space, IVF space, disc height. It's going to tell us a lot that MRIs don't. Specifically, the actual alignment of the spine, if everything's shifted one way, it's going to tell us exactly why it's herniated the opposite way. So the joint spacing matters, the degenerative phase matters. I need the structural picture to create a care plan that's built exactly for your spine. It's not generic. I got to know exactly how long this is going to take. I'm not going to undershoot and I'm not going to overshoot. From there, we'll sit down together. We'll explain everything we found. We'll see if you're a good fit for the office. See if we can help. There's about 5% of people, they've waited too long. We can't help. If it's bone on bone, it's not us, right? But if you got some space, we can work with that all day. With the images in front of you, you'll be able to see exactly what I'm talking about. You'll understand what's happening and why before we ever begin treatment. Now, spinal decompression, right? This is the optimal non-surgical disc option. It's one of the most powerful tools we have, disc-related, for back pain. It's not widely known outside of specialized practices. Here's how it works. You lie on our Triton decompression table. A harness is going to be positioned around the pelvis, around the specific disc that we need to open up for you. The table applies a precise computer-controlled traction force that gently separates the vertebra, creating a negative pressure inside the affected disc. The negative pressure does two things. It draws herniation and bulge material back towards center. It creates a pumping action that draws oxygen and nutrient-rich fluid back into the disc. This is going to promote actual healing of the disc tissue. Sessions are typically between 12 and 15 minutes. Maybe 5 if you're a real acute case and you can hardly move. We got to do a little bit less. Sometimes you feel nothing. Sometimes it's a little bit more aggressive. Most patients describe it as relaxing. We typically recommend a series of sessions over several weeks, and many patients notice significant improvement within a few visits. Often, depending on the severity, we will combine decompression with soft wave therapy. This is going to be using acoustic wave technology, helping stimulate, repair, and regenerate the tissue level. Might be an L4, might be an L5, might be a piriformis. This combination is going to produce better outcomes, and it's going to be suited for more chronic, more severe conditions. We have people coming through all the time, either through vacation, on vacation. They need somewhere to go. They're debilitated. We'll put them on a protocol that gets them back into action in no time. What not to do with back pain though? Look, there's a few common mistakes that make things worse and really do delay recovery. So let's get into this and talk a little bit about what not to do if right now you're dealing with these kind of symptoms, because I've seen it time and time again. We're our own worst enemy and we will make it worse. Mistake number one, complete rest, right? The old advice of rest for a week is way largely abandoned. No evidence based, because now we know that movement is medicine, right? Prolonged bed rest leads to muscle deconditioning, joint stiffness, often will worsen the pain. So look, not a lot, but light movement, walking, gentle activity is almost always better than just lying still. Mistake number two. So relying on pain medication. I get it. Things are aggressive, things are severe, you waited too long. But we've discussed this, right? Medication will mask the alarm. It doesn't fix the problem. This includes over-the-counter muscle relaxers, right? Ibuprofen, any prescription drugs. Use them for short term, okay? Do something else while you're doing it. Don't mistake feeling better for having gotten better. We're not chasing the feeling. The body's giving you a reason, an alarm. It's giving you something that needs to be fixed. So look, mistake number three, waiting too long. I cannot tell you the amount of times and the amount of people I've seen who have been dealing with back pain for 2, 5, 10 years because they kept thinking it would go away on its own. The longer a structural problem goes uncorrected, the more disc degeneration, scar tissue, permanent damage, and compensatory dysfunction accumulates. Earlier intervention always means easier correction. Okay, so mistake number four. You're not going to wait, right? Mistake number four, treating just the pain and not the cause. If a bone is broken, you don't just take painkiller. You don't just take a painkiller and call it fixed. The same logic applies to spine structural problems. The pain is a symptom of a cause, right? Find the cause, please. That's what this is about. Find the cause, take the time, love on yourself, and invest in what is truly going on. So look, how many visits? I get it, right? Give an honest answer. Like, how many visits is it going to take to fix? I'm going to be straight with you, right? The honest answer depends on three things. What's causing your pain in the first place, right? What's the pattern? What's the time frame it's been there? And what's the environment between your visits, right? How are you living? Those three things are going to give me a really good idea on the severity and where we're going to go from here. A recent acute muscle strain just happened on the ball court, right? Just happened at the workstation, right? This might improve in about 4 to 6 visits, okay? But a chronic disc herniation, it's been there for years, might require 3, 6, 8 months, right? Consistent care. I know that's not the 3 visit and you're fixed answer that you might be hoping for. And we see it all the time, but my old chiropractor got it fixed in a few. But I'd rather give you the truth than a promise that I can't keep. Here's what I can tell you. Most people feel meaningful improvement within the first 2 to 4 weeks. Consistent care. The goal is never to keep you here coming forever. The goal is to correct the problem, give you the tools you need to maintain your health, and then step back. So look guys, if you're dealing with back pain, right, you're in the Ames area, you're ready to actually find out what's causing it, not just manage and try to get by, I want to invite you to come see us. We're located at 1110 Buckeye Avenue in Ames, Iowa. New patients can schedule online, www.theconnectchiro.com, or you can call, text us at 515-934-8267. Of course, walk-ins are always welcome. And finally, if this video helped, right, please just share with someone who's dealing with back pain. You can subscribe to this channel. We put out educational content every week for people who want real answers about their health. And I can't wait to see you on the next